Tesla halts auto production at Shanghai plant and Chinese are flocking outside China to get a Western vaccine after end of Chinese zero-COVID policy. Before we proceed, please like and subscribe. Tesla halts auto production at Shanghai plant in rare Christmas suspension. China's COVID-19 outbreak takes out plant employees and suppliers. Tesla car production at its Shanghai plant extending a planned 8-day production halt at its largest worldwide plant by car output. COVID-19 infections have washed over China in recent weeks after Beijing eased its zero-COVID policies, taking down workers at car makers and their suppliers, as well as dealership staff. Fewer potential customers have been visiting stores as worries of being infected remain elevated. Tesla's Shanghai plant was forced to shut down for weeks earlier this year because of COVID-19 related disruptions, prompting Wall Street to temper its expectations for the car maker's growth this year. Demand in the world's biggest auto market has been weak since October, as Beijing's stringent COVID-19 control measures forced businesses to shut and confine potential buyers at home. Car sales in November fell 9.2% from a year earlier, according to official data. The China Passenger Car Association on Friday forecasted nationwide car sales in December to grow by 4.5% from a year earlier, a relatively modest growth rate given the year-end expiration of subsidies meant to make EVs more attractive. EV sales, a growth engine for China's car market, have significantly slowed since June. In the third quarter of the year, Tesla said it produced 22,000 more cars than it delivered globally, fueling concerns of slack demand, especially in China. The company has lost roughly 70% of its market value since its stock hit a record high in November 2021. Tesla chief executive Elon Musk said Thursday on a Twitter chat that he expected the global economy to fall into a serious recession in 2023, pulling down demand for big-ticket items. He said Tesla's gross profit margin has been higher than its peers, which gives it room to maintain sales growth by slashing prices. The car maker has doubled the discounts offered on its two most popular models delivered in the US this month. In China, Tesla cut prices in the fall as Warren Buffett-backed BYD company widens its lead over Tesla. The American EV maker is offering various incentives to move cars off lots before the new year. Tesla's Shanghai plant accounts for more than half of the company's global car deliveries. During the 5 months from July to November, Tesla sold more than 332,000 Model 3s and Model Es from the Shanghai plant, 44% of which were exported to markets outside China. Mainland Chinese vaccine tourists flocked to Macau for mRNA COVID jabs. Explosion of cases and ban on more effective Western shots lead residents to look abroad. Mainland Chinese eager to secure Western messenger RNA vaccines rather than domestic jabs are flocking to Macau, where they have booked out the only hospital offering the inoculations to tourists. Beijing has not approved any foreign COVID-19 vaccines for use by its citizens, instead relying on jabs from Chinese groups Sinovac and Sinopharm. Analysts have said these provide lower levels of immunity than Western alternatives, which use mRNA technology. But an abrupt U-turn by Beijing this month on its former zero-COVID policy of containing the disease has sparked an explosion of cases and prompted a surge in the number of mainlanders seeking mRNA jabs in Macau. The former Portuguese colony and special administrative region is the only place outside mainland China where the country's citizens can travel without having to quarantine on return. The vaccination slots have been quickly booked up as China's outbreak has spiraled out of control. In October, Ivy, a 27-year-old resident of Dongguan across the border in mainland China, received her first mRNA dose at the Macau University of Science and Technology Hospital, the only place administering jabs to paying tourists. Last week, she returned to the hospital for another dose but discovered that the vaccination slots were fully booked until the end of December. A customer service official at the Macau hospital said his phone had been ringing non-stop since the outbreak started gathering pace in China in early December. He noted also, however, that there had been an increase in customers cancelling appointments after catching the virus. China's patchy vaccination coverage had laid the foundation for the chaos gripping its medical system as hospitals became overwhelmed by sick patients after the end of the zero-COVID policy, analysts said. About 85 million people, one-third of the 267 million Chinese citizens aged 60 and over, have not received a third vaccine dose needed for a high level of protection against the Omicron coronavirus variant. Among those aged 80 and over, this rate is about 60%, or 21 million people. Beijing has pledged to devote more resources to plugging the gaps in vaccination coverage. But Yanzhong Huang, a senior fellow for global health at the Council on Foreign Relations think tank, said these efforts might be too late. The rise of vaccine tourism was being driven by wealthy mainlanders with access to scientific studies comparing vaccine efficacy, said Nicholas Thomas, an associate professor at the City University of Hong Kong who specializes in Chinese foreign policy and Asia health security. A Lancet study from Singapore published this month found individuals who received 3 doses of the Sinovac or Sinopharm jabs, which are based on older technology that uses the inactivated virus to elicit an immune response, were nearly twice as likely to develop severe COVID as people who received 3 mRNA jabs. Those with the Chinese shots were also 50% more likely to be hospitalized. The brisk business of vaccine tourism in Macau has quickly given rise to middlemen who charge fees to arrange travel and other logistics. Viola, a Macau-based insurance agent, told the Financial Times that she charged $60 to arrange vaccination sessions for her mainland clients. One 27-year-old management consultant, who identified himself only as Juan, and his wife paid $170 each for 1 dose of the mRNA vaccine after deciding against being injected with domestic alternatives. The consultant said the couple had concerns about the efficacy of Chinese vaccines and a lack of transparency over the trial data. Like and subscribe.